Hello, my name is Jordana Azevedo-Martins, and I will talk about my work entitled Gastric Cancer Spheroids Responsiveness to a Set of Small Molecules. Talking about now gastric cancer, it is the third in mortality and fifth in incidence in the whole world in both sexes. It's normally an aggressive tumor with no classification consensus. The treatment strategy is usually surgery followed by chemotherapy. If it is treated in the early stages, the survival rate in 5 years is about 90%. However, due to the lack of specific symptoms in the early stages, most patients are diagnosed in the advanced stages when the treatment is limited. So a better tumoral biology characterization is needed to improve the diagnosis and therefore increase this patient's survival. We aimed to verify whether some compounds, known as antineoplastics, could affect gastric cancer spheroids. Compounds such as sirolimus, violacin, 3-bromopyruvate, calyxyserine, erlotinib, and mitoxantrone. So the methodology. On the first day, the gastric cancer cells, Cato3 and 2312387 cells, and the normal cell line GS1 were plated in a 24-well plate. On the second day, nanoshuttle particles were added and the cells were incubated for 24 hours for a magnetization. On the third day, the cells were detached, seated on a 96 wells cell repellent microplate, and placed atop a magnetic drive to attract the cells to form spheroids. On the fourth day, the spheroids were treated with the mentioned compounds. Their morphology was observed by optical microscopy for 24 hours after the treatment to 96 hours after the treatment to see if they were affected or not. An ethical approval does not apply in this present study. So now the results. Here we can see the 3 cell lines, the normal and the cancer ones, before the treatment and after 24 and 96 hours after the treatment. Here are the control that received no treatment at all. Erlotinib at 100 micromolar affected Cato3 spheroids border after 96 hours. Mitoxantrone at 15 micromolar dissolved the cell-to-cell interactions of Cato3 and GES1 spheroids, and it changed the overall morphology of 2312387 after 24 hours, and it drastically reduced the size after 96 hours. Violacin at 10 micromolar dismantled the border of GES1 and Cato3 spheroids after 24 hours, but the results were better seen after 96 hours. The other compounds didn't show any effect. So, the results suggest that violacin, mitoxantrone, and erlotinib can be considered as gastric cancer potential therapeutics. We acknowledge CNPq and FAPESP for the financial support, and I'm also grateful for Unicamp, for Institute of Biology, and my lab, the Oncobiomarkers Research Lab. Thank you for watching.